Vanakkam, and welcome to This Explainer. Today we are looking at our body's absolute biggest, most complex manufacturing factory. In Tamil we call it the Kali which translates perfectly to what we know in English as the liver. Think of the Kali as a massive industrial complex, working 24/7 inside your body. It processes toxins, manufactures vital proteins, and manages waste. But how do we know if this massive factory is operating efficiently? Well, we conduct a factory audit. And in the medical world, that rigorous audit is known as the liver function test, or LFT.
To audit this factory, here is our game plan. First, we'll define what an LFT actually is. Second, the purpose of the test. Third, the 8 key components. Fourth, clinical diagnosis. And finally, nursing responsibilities. We're going to decode the medical jargon step by step, so reading these lab reports becomes incredibly easy for you.
All right, Section 1. What exactly is an LFT?
In basic Tamil terms, this is a Ratta Parisodhanai, a blood test. But a liver function test isn't just one single check, It's a comprehensive group of blood investigations used to assess the overall functioning of the liver, detect underlying diseases, and, very importantly, monitor how well a patient is progressing during a course of treatment. Basically, this is our absolute baseline report card for checking the factory's overall health.
Moving right along to Section 2, the purpose of the test. Why do doctors actually order this? So the crucial point here is that this test serves multiple highly dynamic roles. Yes, it assesses the basic functional status of the cow liver, and it helps diagnose major structural disorders like hepatitis and cirrhosis. It can even detect internal blockages like a bile duct obstruction. But crucially, this test is also actively used to monitor treatment effectiveness over time and to evaluate any potential liver damage caused by powerful drugs or severe infections. It's not just for finding initial problems, right? It's an absolutely vital tool for ongoing surveillance. Okay, Section 3, the 8 components. This is where we really get into the weeds of our factory audit. To remember all 8 of these specific departments, we're going to use a Tanglish mnemonic, BAAAGAAPP. First, let's look at the Tamil meaning. Bilirubin Ramba Atigama Surantu, GGT, Albumin Matrum Protein, PT Nilaye, Matruyartu. Okay, so in English, that means bilirubin, the B, is secreting atigama, or abundantly, giving us our 3 A's, ALT, AST, and ALP. And this affects our G, which is GGT, our A, albumin, and our 2 P's, total protein and prothrombin time. Let's break down each of these workers. Now, what's really interesting about this slide is the critical normal value for our first component, serum bilirubin, which sits at exactly 0.2 to 1.2 milligrams per deciliter. Bilirubin is essentially a pigment formed from the breakdown of hemoglobin in your blood. You can think of it as the factory's waste management metric. When this waste piles up and exceeds these normal levels, it indicates bile duct obstruction, hepatitis, or what we call in Tamil manjal, which you probably know in English as jaundice. Next up, we have 2 very specific worker enzymes inside the factory, ALT and AST. ALT, or SGPT, is an enzyme mainly present right inside the liver cells. If ALT is elevated, it's a very specific indicator of liver cell injury or hepatitis. On the other hand, AST, or SGOT, is a bit of a multitasker. Yes, it's found in the capillary, but it's also found in the heart and muscles. So an elevated AST means there's damage somewhere, but the doctor has to investigate if it's our liver factory or perhaps a completely separate heart or muscle issue. Now let's walk through the rest of the factory departments in this structured breakdown. Our next 2 tests are ALP and GGT. These are essentially your bile indicators. Increased levels of alkaline phosphatase, or ALP, and gamma-glutamyl transferase, or GGT, strongly point to biliary obstruction. Basically, imagine a massive traffic jam in the factory's export pipes. Then, we look at the factory's actual production output, serum albumin, total protein, and prothrombin time, or PT. The liver actively synthesizes these critical elements. For context, a normal albumin value is 3.5 to 5.0 grams per deciliter. If albumin or total protein levels are decreased, or if the prothrombin time, which measures how fast your blood clots, is prolonged, it means our factory's manufacturing capabilities are severely impaired, and that often points to chronic liver disease. Which brings us right to Section 4, clinical diagnosis. How do doctors use these numbers?
By analyzing specific patterns in the LFT, doctors can accurately diagnose several major conditions. Sticking with our tummal first approach, we first look for manjal kamalai, which is jaundice caused by that bilirubin buildup. We also detect kaliadal vicum, indicating hepatitis or the long-term scarring known as cirrhosis of the liver. The data also helps diagnose fatty liver disease, potentially dangerous liver cancer, and those biliary obstructions we just talked about. It's truly a comprehensive diagnostic toolkit for your doctor.
Finally, Section 5, Nursing Responsibilities.
Let's move to and see how this builds. Getting an accurate LFT requires a strict chronological action plan from the nursing staff. Step 1. The nurse must clearly explain the procedure to the patient and obtain their informed consent. Patient communication is absolutely key here. Step 2. The actual ratha parisothanai, or blood collection, must be done using a completely sterile, aseptic technique to avoid any sample contamination. And Step 3. The nurse must monitor the patient post-draw for any complications, and most importantly, ensure that these critical samples are transported to the laboratory in a timely manner well before those enzymes begin to degrade.
So I've gone from the raw Tamil and English definitions through the bag-a-pick components, all the way to clinical diagnoses and nursing care. And I want to leave you with a provocative question. What would happen to your body if just one department in this massive Kalirel factory stopped working today? I really encourage you to appreciate your liver's hard work. Next time you get a health checkup, try reviewing your own lab report using the